and welcome to another Social Security segment brought to you by CAN TV. My name is Maritza Alvarado, and I will be your host for today. I am currently a claims representative at one of the offices located on the northwest side of Chicago. With me today is my co-host, Lori Parquet. Would you please take this time and introduce yourself to the viewing audience?
Good afternoon. I'm Laurie Parquet. I'm a public affairs specialist with the Chicago Regional Public Affairs Office for Social Security.
And we wanted to inform you that this is a live interactive calling program. So if you have any questions related to a Social Security matter, if there's a concern, or you're just curious on how to go about filing for benefits, give us a call. The phone number is located at the bottom of your screen, and that phone number is area code 312-738-1060. We will try to answer your questions to the best of our ability. Now, if we don't discuss anything that's related to your concern, just give us a call either way. We're going to try to cover as much as we can in the half an hour that we have. Now, I do want to remind the audience that we have about 3 shows left. So I encourage you to give us a call because we'll probably be back during the fall season. So before we get started, I just wanted to let everyone know that we are no longer issuing Social Security number printouts. There has been a high rise in identity theft, and we used to give out those printouts, especially to those individuals that are filing for unemployment benefits. The unemployment agency would send those clients to us to get a Social Security printout. But because of the high rise in theft, we stopped that. So in order for you to get a Social Security number or your Social Security number, you would actually have to file for a replacement card. And how can they do that, Lori?
Well, Marissa, do we really need a Social Security card? Do you need a replacement card? What you really need to do is remember your number. For most intent purposes, remembering your number and being able to identify yourself is good enough for a lot of reasons. Okay, so you may not even need a card.
Okay, it looks like we have a caller on the line. Caller, do you have a question?
Yes, great show as always. I'd like to know why. I'm 69 years old, worked all my life, worked to get my Social Security, Medicare. But what I want to know is why people, able working people, other people that never worked a day in their lives, get Social Security, Medicaid, Medicare, like I do. Now, I've worked all my life for what I got. Why do people that never put a penny into it get money instead of letting all the other people that worked hard get more money for themselves? Thank you.
Okay, we can answer those questions. There's a lot of, variety of benefits that we are able to help the public in. There's retirement benefits, there's Medicare benefits, there's ability benefits. There's 2 programs that Social Security offers. One is the retirement plan and the disability plan. Basically, it's for individuals who worked and paid into the system. So when they become of retirement age, which right now is 62, the earliest, and they paid into the system and they work for more than 10 years, they get a benefit amount depending on how many years they put into the system. There's individuals who have never worked or have worked but worked less than 10 years, and they can qualify for the other program that Social Security offers, which is the SSI program. It's Supplemental Security Income Program. That program is based for individuals who have low income and resources. It's like a government welfare plan. So if a person doesn't have the 10 years or never worked in their life and they are low income and resources, they may be eligible for the SSI program. Okay, so that's probably what the issue is. You may get a Social Security retirement check. You see that someone, a neighbor or friend or family member that's never worked in their life, get a check as well. Well, they're probably getting the check through the SSI program, and that's more like a welfare-based program. You can't have income more than $733 because I think that's what SSI provides is a check for just $733. If you're getting a Social Security check that's more than that, you won't be eligible for SSI. Okay. So, in going back to the Social Security card, we're not issuing the printouts anymore. You are not able to file for a Social Security card online. You would actually have to download the application and go to your local office. If you are a first-time mother or if you have children and newborn babies, they actually do the application through the hospital.
Yes, Marissa, that is true. So if they need a Social Security card for their new baby, you may be trying to file taxes for your new baby. You may be applying for government or social services. If you need to do any of that, you may need a card for your new baby. So just like Marissa said, in the hospital, they may take that Social Security card application at the same time that they're taking the application for your birth certificate. And if they don't do that, you will apply for your baby's Social Security card in the same manner that you will apply for your own.
Okay, so we have internet services available on our website. Our website is www.ssa.gov. In our website, you can find a lot of information. You can find information about retirement benefits, Medicare benefits, disability benefits. You can also get information about filing for benefits for a child. Now, the good thing about our website is that not only does it give you a plethora of information, it also allows you to access your Social Security record. And by doing that, you need to create an account with SSA. And how can they do that, Lori, with our website?
Well, while you're on our website, you may open a My Social Security account at www.socialsecurity.gov/myaccount. It can help you plan for your retirement. You can check your earnings history, and you can request a Social Security statement.
Mm-hmm. And that's important, that Social Security statement, because Social Security stopped mailing those out. So if you need to check what your earnings are, if you have your 40 credits, if you need an estimate of what your benefit will be if you were to retire or if you become disabled, your Social Security statement will be accessible through the MySSA program, well, the www.ssa.gov. Create an account, you need an email, and you will have access to all your information. Another good tool that we have on our website is the Retirement Estimator. And I just wanted to reiterate that the benefit statement that you get, or that you receive, or that you have access to on the online services, it's just an estimate. I have a lot of clients coming into the office under the impression that what's given to them on the Social Security statement is what they're going to get when they retire. That's not the case. It's just an estimate because the agency doesn't know if you're still working, if you stop working. They're estimating what your earnings are going to be based on last year's earnings. So that's why at the top of the letter says your estimated benefits. Now, if you wanted to know what your benefit will be, I suggest that you go to our website, www.ssa.gov, and you can go to the Retirement Estimator, and that will tell you what your benefit will be. Now, if you are planning to retire, keep in mind that the earliest age that you can retire is at the age of 62. And if you are filing for benefits before your full retirement age, you are subject to the annual earnings limit. Is that correct?
Yes, that is correct, Marissa. If you retire before the age of your full retirement age, you are subject to the work test, which means that if you go over a certain amount, it affects your retirement benefits. We would hold $1 for every $2 that you receive of Social Security.
Mm-hmm. That's correct. So for any of the individuals filing for their benefits before the age of 66, your checks are permanently reduced and you're subject to an annual earnings limit. Now this year the limit is $16,920. So if you file for benefits with Social Security, we need to know, are you working? Are you planning to stop work? What are your earnings for these years? We need to know what your earnings are for this year because we need to be able to tell you whether you'll be able to get paid or not. If a person is working this year and they have plans on working for the entire year and they estimate their earnings to be $35,000, we're going to tell you right then and there you won't be eligible for a check unless you stop working. Why? Because you're making more than the limit. That's why it's important that you give us an estimate on what your earnings are going to be this year if you decide to continue to work. Now, if you stop working, that's great. We can start your benefits when you stop working depending on what your earnings are for this year. Another good thing is that if you are receiving a retirement check already and you are working on a part-time basis, the good thing is that your Social Security check may increase. It's all dependent on what your earnings are. Is that correct?
Yes, it is. You will get credit for every month that we do not pay you during your time that you're on Social Security. So if you come on reduced and we withhold maybe 3 checks a year, at your full retirement, we will give you credit for them 3 checks for the 3 months that we did not pay you. At full retirement, you will get credit for any months during the time between your retirement that you came on the record until the full retirement. Full retirement is when you get the credit. Some people's full retirement is age 66, and it dwindles up to age 67. So minus 67, someone else's would be 66 and 6 months. But whatever your full retirement is, that's when you'll get the credit for every month that we did not pay you.
And that's correct. And the way they calculate your retirement benefits is they look at the last 35 years of your high earnings. So if you're still working and you're getting a Social Security check and your earnings is one of the high earnings, then your Social Security check can increase. We do that at the end of the year. You'll get a letter letting you know we recomputated your benefits because of your earnings. Your benefit amount is going to increase. Now, a lot of people think that because they file at the age of 62, they are under the impression that when they turn 66, they get their full benefit amount. That's not true. Once you file, it's a permanent benefit and it stays locked in. The only way that your retirement check can increase is if you continue to work or we have a cost of living. Now, we do not know if we're going to have a cost of living at the end of this year. It's based on what the president decides. We get that notification usually around December. So those are the only 2 ways that your Social Security retirement check can increase is by working or the cost of living. Once you file at before 66, that's a permanent check and it stays permanent. It's not going to give you that full benefit amount at 66. That's why it's important for you to decide what is best for your financial situation, if it's best for you to start them at 62, or if it's something that you can delay your benefits until the age of 66 or 70, because you get an 8% increase after the age of 66 if you decide to delay your retirement benefits. Now, if you are 65 years or older, you will be eligible for Medicare. Why don't you discuss the Medicare options for the individuals?
Well, Marissa, so let's talk about Medicare. Medicare Part A. Medicare Part A is the hospital insurance, and Medicare Part A is free. There is no premium for Medicare Part A as long as you are insured. Let's talk about Medicare Part B. Medicare Part B is the part for you to go to the doctors. You can go to the doctors. It covers outpatient care, and it covers equipment, light equipment, things like that. There's a premium for the Part B. In 2016, the premium was $121.80. 2017, the premium is $134. If you receive a check from Social Security, we take that premium out of your check before we send it to you, and we send it to Medicare on your behalf. If you do not receive a check from Social Security, Medicare will bill you for that premium.
Go ahead.
There's another part of Medicare. Let's talk about Medicare Part D. Part D is the prescription drug plan. The prescription drug plan usually has a premium. There are various plans that you can apply for. There's an extra help plan that you can apply for to help you with that premium if you have low income and resources. And we have one more plan, which is the Medicare Part C. And for that plan, you will contact your Medicare services at 1-800-MEDICARE to see what plans, the Part C, those are the Advantage plans. They pay the other 20% because Medicare only pays 80% of the bills. The Advantage plan pays the other 20%. And there's also a premium for most Advantage plans. So you would call Medicare to get information on those. So Marissa, those are your Medicare health plan.
Oh, that's good. Well, if you are 65 years old and you are not collecting a Social Security retirement check, we recommend that you file for Medicare because we need to explain to you what your options are in regards to Medicare Part B. Like Lori said, there's Medicare Part A. Part A is free, and it's free for those who have worked and paid into the system for more than 10 years. There's no premium for that. The Part B, like Lori said, everyone, whether you paid into the system or not, everyone pays for those premiums. The premiums are dependent on how the economy is doing. So this year, the premium is $134. So there was an increase for this year. The Part B, like Lori said, covers 80% of covered costs. It's mostly for doctor's visits and outpatient services. So if you are working and you have health care coverage through your work and you're 65 years of age and older and you are not collecting a retirement check, you actually have the option to opt out of the Part B because you have work through current, you have health care coverage through current work. Now, if you are not working and you are not covered through your work or through your husband or your wife's work or your spouse's work, then it's recommended for you to enroll for Medicare Part B with us because we do not want to impose a penalty for you in the future. So if you, again, are not working, you don't have health care coverage through current work or through your spouse's current work, you're over the age of 65, it's recommended that you come and contact us about Medicare so that way you won't be imposed a penalty for the Part B. The Part D is the prescription drug plan program. It's dependent on what healthcare provider you enroll with. The premiums are, it depends, it's different for each healthcare provider, so it can be between $20 to $30 a month. If you are collecting a Social Security retirement check and you are 65 years old, the premiums will be automatically deducted from your Social Security check. And like Lori said, if you are not collecting a check and you did enroll for Medicare, they are going to be billing you every 3 months for those Part B premiums. There are 3 ways for a person to be eligible for Medicare. One is at the age of 65, which is what we discussed. The second is if you are a renal recipient or a patient and you're undergoing dialysis. They do Medicare for individuals who have renal failure undergoing dialysis. The third way you can get Medicare is if you are collecting a Social Security disability check, and that is the disability program where you worked and paid into the system. It's not SSI. So if you are collecting a Social Security disability check for more than 2 years, your Medicare kicks in after 2 years worth of checks. So those are the 3 ways that you are eligible for Medicare. Okay. Now for disability, like I said, it's 2 programs. One is disability program. It's also known as SSDI, and then there's SSI. The difference between those 2 programs is that one program, people work and pay into the system, and depending on how long they worked and what they put into the system, that's how Social Security calculates their benefit amount. The SSI is basically what your income and resources are. So there are people that can collect both. There's people that can only collect one. It's all dependent on your situation. But you can get more information through our website, right?
Yes, you can get more information through our website. So please log on to www.socialsecurity.gov.
Mm-hmm. Now, another helpful item that we have on our website is publications, you can request for a publication via our website.
Yes.
So if you have retirement or disability or Medicare, if you have a pension not covered by Social Security, that's another publication that you can request. Is that correct?
Yes, it is. And you can also go on the website and open up your own free Social Security account. At www.socialsecurity.gov/myaccount. And when you open up that account, it opens up a whole avenue of things that you can do. You can see an instant estimator. You don't have to do anything. It'll tell you how much you give you an estimate of your benefits if you were to retire at the age of 62 through your full retirement age. It will tell you, you can verify your earnings, and the earnings that we have there are the earnings that are reported to us from the IRS. If you don't agree with those earnings, that would be the time to come to us with some proof of your earnings before you retire. There's a lot of planning tools. It'll help you get situated and help you plan for your Social Security benefit and when you get ready to receive it. Remember that the Social Security program is really a supplemental program. It was made to supplement what we saved during our lifetime. So the important thing is to have financial literacy and plan for your retirement, and then plan for how much and how long you plan to work, so that when you get your Social Security check, it's going to be enough for you to survive. Okay? So again, at www.socialsecurity.gov and /myaccount and open up that account. Marissa?
It's important. That's why we have all this information for you, because we're getting more technological. We're trying to be up with technology, and that's why we have our internet services. We have the MySSA account, because if you don't feel like coming into the office, waiting in the long lines, if you don't feel like calling the 800 number and waiting 45 minutes to an hour just to get a simple answer that you can get on our website, why not open up a MySSA account? It's secure, and I know a lot of people are hesitant to open up an account because of identity theft and whatnot, but our website is secure. Everything is in the palm of your hands. You can decide, like Lori said, you can decide what you want to do based on your finances. It will tell you whether you can, be comfortable with what you're earning right now, if you're getting a pension from work or from another, source of income. It can also tell you, you know what, I think I'll delay my benefits for, a later time because I'm comfortable right now. Another thing you need to consider if you're getting benefits with Social Security is, your health. A lot of people want to get the money as soon as they're eligible for. There's some people that say, no, I feel that I'm going to live for a very long time, so I want to delay my benefits. There's individuals who are married. They have the option to collect spousal benefits at the age of 66 and delay their retirement benefits till the age of 70. We have a lot of cases like that. There's a lot of information that we have that we would like to provide to you, but you have to make that first step in contacting us so that we can explain to you what your options are. Okay? So if you have any questions or concerns, you can call us, or you can call the 800 number, and I will provide that for you right now. It's 1-800-772-1213. We're open from 7 in the morning to 7 o'clock in the evening, Monday through Friday. We also have our telephone automated services 7 days a week, 24 hours a day. So if you have any questions or concerns, give us a call. Go to our website. It's right there, www.socialsecurity.gov. We have a lot of information there. We have Medicare, which is what we discussed today. We have disability information. We have retirement information. We also have SSI information. Right now, they're doing a program on SSI internet claims. Because we used to not do that on the internet, we are accessing that right now. But if you have any questions, again, there's our phone number, there's a website, give us a call. We'll try to contact you as soon as possible. We wanted to let you know that this is the end of our session. If you have any other questions, just call the 800 number. On behalf of Lori and myself, we wish you a great evening.
Have a good evening.